Assalamu alaikum. Welcome back from the ad break. You're still watching Prime Live. Up next, we have with us in studio Ronald Abvajee, who is our wellness expert, and we want to commemorate or speak about a very important issue, which is oral health, because it is National Oral Health Month, and we were speaking just before Ronald came in studio about the importance of watching out. Always watch out for that oral health. And yeah, I think we have a lot of focus areas that we would like him to shed light on. So this is going to be a fantastic conversation. Assalamu alaikum, Ronald. Welcome to Prime Live.
Wa alaikum salam. Good to be with you.
Good to be with you. First of all, is your birthday today or was it yesterday?
Yesterday.
Okay, I want to say how old are you now? But happy birthday.
You don't
birthday.
want to know.
Oh, Ronald, thank you so much. But I think we just want to get straight into it. During National Oral Health Month, many people are, more aware of the importance of oral hygiene. Can you tell us about the relationship between oral health and your overall health?
It's such a prominent link, but we often choose to ignore it. That poor oral health is associated with increased risk of diabetes and doubling your risk of heart disease. Doubling your risk if you don't look after your oral health. A lot of us chase the aesthetic appeal of oral health, but it's actually linked to that because inflammation in the mouth impacts our gums, which could increase our risk of gum bleeding, etc., which makes bacteria, it makes our bloodstream more accessible to the bacteria. So it can enter our bloodstream, increase the inflammation, and literally double our risk of heart disease. So there's a direct correlation between the two.
And a lot of people struggle with maintaining a good oral hygiene. I want us to talk about flossing. What are the easiest techniques that people can, start incorporating into their lives to make flossing more easier?
All right, so with a different generational blend, let's talk about flossing as a definition first.
Yeah.
We're talking here about cleaning the interdental spaces, not the flossing that the Gen Zs use in that term. So just be aware of that, right?
Yeah.
The second thing is, flossing is critical because did you know that less than 30% of adults globally floss? But flossing decreases your risk of gum disease by 40%. So a lot of us focus on brushing the teeth, but flossing actually looks after the interdental health, removing excess plaque, etc., from those spaces, food, and so forth. Because some people, because they don't floss and because the interdental spaces are slightly bigger, when they have breakfast, they actually store some in the teeth for lunch. Suck it out and go. That's the risk of it. So you increase the risk of gingivitis, plaque, and of course gum disease. So flossing plays an absolutely critical role in your healthcare and oral healthcare routine.
Most definitely. And I want us to talk about first of all, how often should you floss? After every meal?
They say the bare minimum of flossing is about 4 times a week.
4 times a week.
Ideally, not after every meal, but you want to look at it when you are brushing your teeth, which ideally should be twice a day, not after every meal, but twice a day. You want to then floss. Now, you might say, but Ronald, that's too much. Sometimes my gum bleeds, but gum bleeding is an indication of inflammation. The healthier your gums are, and your technique is correct, you will not get the gums to bleed. So you need to revisit the technique of how you floss, because it's not about skipping it, it's actually about bringing it into your routine. Think about flossing like this. Do you charge your phone every night before you go to bed? Floss every night before you go to bed after you brush your teeth. That's a habit we should bring in to the cadence of flossing.
And I want us to also speak about the toothpick situation. Does that kind of play a part in your oral health? If I don't floss often, but I'm always, I have a toothpick, always toothpicking, does that matter also?
As long as you're not nose-picking, we can work with that, right? But toothpicking, you get the wooden ones, you get the plastic ones, and you get the silicone rubber ones. Have you seen those that are slightly curved? Some of them have the little needles or the teeth in them.
Yes.
So the wooden ones, for me, remove not deep into the interdental spaces. Because if you look at your teeth, it might go in the front, but it doesn't go around the back and or clean where you want it to clean, closer into the gums or not. It might just remove excess debris from the food that you've eaten. Then you look at those interdental ones, which are the rubber silicone ones, it's like turquoise or bluish in color. Those are a lot more positive in the use compared to the wooden toothpick ones, which you get a lot of time in restaurants, but it's not a replacement for flossing. So I think in the day, fantastic thing to use, but it doesn't replace flossing and proper flossing that you need to do.
Most definitely. I mean, that is something that I've just learned now. But let's talk about the latest debate. Everybody's speaking about whether or not the normal toothbrush is better than the electric toothbrush. Which one is better? Does it even matter which one you're using?
I'd have loved to have asked this question when it was stage 7 load shedding. But, but here's the thing.
Yeah.
Electric toothbrushes have been shown to slightly be more beneficial, slightly or modestly more beneficial than manual toothbrushes if you're looking at plaque removal and assisting with, preventing gingivitis. But if you are using a manual toothbrush and you have the correct technique, it is on the same level. So you don't need a fancy electrical toothbrush to ensure that you still look after your oral health. And when you look at the different ages that are ideal, when you look at a child, electric toothbrush gets them into the habit in a fun way of brushing their teeth consistently. When you're looking at it from an adult perspective, if you have the right technique of brushing your teeth and flossing and right oral health care, then of course a manual toothbrush is just fine. And then as you get older, because of dexterity issues and of course maybe arthritic impact or stress on the arms, whatever it may be, you could then look at an electric toothbrush again. But I still say stick to old school. It's not about the technology you use, it's about the technique that you utilize with what we have at our disposal.
You talk about technique, and now I'm wondering if I'm doing it right. What is the right technique to brush
How are
your
you
teeth?
doing it currently?
No,
I'll tell
no,
you.
no, no.
We all want to know
no,
this,
no,
sorry.
no, no. I want to first hear how we do it.
Eh? Old school, put on your finger and then brush your teeth, and there
Oh,
was no.
no.
So what you can do is you apply a moderate amount of toothpaste, and you want to have a fluoride toothpaste, which assists in protecting the teeth and the enamel on the teeth and in the cleaning process. Don't fall for colors of the toothpaste. It's just marketing messages through and through. A lot of the people look at charcoal toothpaste now, etc. As long as it has a good fluoride content within it, you're okay. If it says fluoride in the ingredients, then you can either go straight into the mouth, or you can put it under the tap. And as you go into the mouth, you want to have a soft bristle toothbrush, because the harder the bristle, the more aggressive it is on the enamel of the teeth. And plaque is formed on that thin layer that discolors the teeth. Even in what we eat or drink impacts the color of our teeth. So gentle circles. You don't have to abrasively scour or scrub your teeth. Please be aware, this is not exfoliation.
Yeah.
But gentle cleaning to remove the bacteria, and of course to maximize gum health. And you want to look at 2 to 3 minutes of gentle circular motions, front, back, underneath, and do not forget the molars.
Okay, that's very interesting, and I think I like that you mentioned the soft brush thing, because with us, I was under the impression that if the brushes are a bit like soft, they're not doing the work. Like it needs to be like iskoro brachinyan. I'm joking, not that hard, but like you need to feel that it's brushing the teeth. It shouldn't be too soft.
Like pressure, you want to feel pressure.
Pressure,
So
that's the
even
word.
with the soft bristle toothbrush, it's not about how hard you are pushing against the teeth.
Yeah.
Because you could actually damage the enamel, get nerve damage, and of course, get the gums to bleed again. So it's about gentle cleaning. And if you take your tongue over your teeth, fantastic, it'll be clean. But do not forget your tongue health as well. That's also part of oral health.
Oral health, most definitely. I want us to talk about oil pulling and the benefits of it, but for those who may not be familiar or who do not know what oil pulling is, please tell us about it and then give us the benefits.
I love this because I was asking a couple of people today, and all the Indian people that I asked were like, we know this, man. It's like amla oil for our hair.
Oh, wow.
But oil pulling is when you take either a virgin coconut oil and or sesame oil. Some people utilize it. It's known as an Ayurvedic treatment. Ayurvedic is ancient Indian medicine, herbal medicine. And you put it into your mouth and you literally swish the oil around your mouth for 15 plus or minus 10 to 15 minutes.
Any kind of oil?
Virgin coconut and or sesame is what is traditionally utilized. And you literally for 10 to 15 minutes are swishing it around your
that
mouth.
on TikTok, but I thought it's not. I was like, why are people
I don't know about you. I don't have 15 minutes to swirl things in my mouth, number one.
Yeah, 15 minutes is a lot.
It's a long time, but that's what you have to do. But when you look at the oil pulling, or I call it oil swishing, because it's swishing around your mouth, many people believe that it maximizes your oral health care. Did you know that according to the Journal of Oral Health and Community Health, it has been shown to have modest improvements in removing bacteria, but not massive improvements in overall teeth health. So for me, if it works for you compared to mouthwashes, fantastic. But it's in supplementation to brushing and flossing, and do it post you've done the traditional oral health mechanism. So it's in supplementation of and not in replacement of.
And I want to also touch on the mouth washing. I like that you mentioned that. Can you just rely on mouth washing? I've seen people do this, right? And maybe brush. Like, does it cancel out the whole brushing of the teeth? Where can I say, let me say I'm using mouthwashes like 3 times a day and then maybe brush my teeth once a day. Can it work, or do I still need to incorporate it within, like oil pulling? Maybe brush, do all the things, and then mouth washing, because I don't think people know what a mouthwash is for.
So mouthwash is for you. It's for lazy flossers. One, it's very pungent in taste. So for those that have halitosis, which is bacteria in the breath or debris in the mouth, or they don't brush their tongues properly, you get halitosis or foul smell from the mouth.
Okay.
Right. Number two, it's also it's people think it's cleaning everywhere, because you ideally think like oil pulling. It's going through all the crevices inside the mouth. You're gargling. Number three is, more often many people don't use mouthwash for very long, because it is a bit pungent and it does get a bit uncomfortable. But also, old school mouthwashes are very alcohol based in certain areas, and there's a lot of chemicals in there. I'm very wary of it. So personally, I don't like mouthwashes. Neither do I like oil pulling. I prefer to stick to traditional old school brushing and flossing. That's my preference. But in replacement of brushing your teeth, no. But like you said, the routine of brushing twice a day minimum, flossing as often as what you can, and then doing a mouthwash and a oil pulling, that's your discretion and your choice.
Thank you so much for sharing that with us. And I believe that we have a very interesting clip by Dr. Bongiwe, and she's going to be talking to us about, the food that are actually bad for your teeth. So let's take a listen.
I think when it comes to what is bad for your oral health or your oral hygiene, one needs to remember more that moderation is key. So obviously too much of anything is a bad thing, and not enough water is a bad thing. So you can never have too much water, but you can have too much lemon, citrus food, like oranges, drinking. Even if you drink the lemon, it's obviously better than eating the lemon directly. So you do try and, for people that drink lemon water every day, several times a day, that's really good for the rest of your body. But for your teeth, it's probably not great. So I would say follow it up with fresh water, even if it's just a rinse, because you want your mouth to return to a neutral state once you've consumed whatever's bad for your actual teeth. That brings me on to sweets. Obviously, I'm supposed to, and I do say don't eat too many sweets, especially to children, but it's not very realistic for me to say don't. Rather, I help you eat them better. So I normally say, oh my gosh, I'm going to get killed by dentists for this. I normally say if you're going to eat sweets, eat the whole packet in one go. Because frequency is really the root of the evil when it comes to tooth decay. If you eat a sweet, you're creating that acidic environment in your mouth, which breaks down the tooth. So if you only eat it now and not again, your mouth will return to a neutral state, and then it will be free from that acid attack the rest of the day. But if you eat a sweet or sour sweets or whatever every couple of hours, then you're maintaining a very low pH balance in your mouth. So your mouth is acidic the whole day. Foods that are also bad for your teeth are things like cakes, any kind of like a sticky food, or food that gets like stuck in the grooves of your tooth, not so much in between your teeth like meat, but like a sticky food, like a sponge cake. Because it's sticking to your tooth means it doesn't really exit your mouth as easily, so you probably have more remnant of it lasting in your mouth for longer. Again, followed up with a glass of water, you can have a slice of cake. So it's very, I just hope the main takeaway is not don't do this, don't do that, and more do it correctly, follow it up with water. That's the only thing you have to take home.
That was very interesting, and I think, or I hope that viewers at home, including myself, we have learned a lot from that clip. But as we wrap up this insightful discussion, Ronald, I'd like to ask you, what is the one thing that you wish more people paid attention to when it comes to oral health that we are not actually paying attention to?
We are afraid of dentist visits. And if your oral health is not in check or on point, you're trying to avoid them. We also know there's a lot of treatments available for teeth whitening. So my thing is that if you are watching what you're eating, rinsing with water afterwards, and please note, when she said have the whole packet of sweets in one, it's not this size packet. These are small enough packets
Yeah.
that we've got to be aware of. But I love what you said in the context of changing our approach and our strategy. And if we view oral health care as preventative medicine rather than painful experiences, we will appreciate our teeth and our oral health a lot more. And we'll literally look after it with the right flossing, brushing and scraping of the tongue, and brushing correctly with soft bristle toothbrush in small circular motions, and literally having pearly whites and non-smelly breath.
And just before I do let you go, I want to speak about the whole teeth whitening thing. And I think there's a lot of products that are out here that people are trying out in order to whiten their teeth. And one that is very popular is apple cider vinegar. Rinse with apple cider vinegar in the morning and the evening. How healthy is that for your teeth?
So again, if you're rinsing with apple cider vinegar, it's highly acidic. The mouth is already acidic, and you're accentuating really bacterial growth in that process. So what's more important to you, looking after your oral health and preventing heart disease and other things, or is it really about the pearly whites, or should you just have brushed properly from the beginning? I would say home remedies for me, I'm very wary of, and over-the-counter treatments. You've seen on TikTok, they got the mouth guards, the lights, you put this in, purple, bright shining lights, etc.
Yeah.
They forget to show you how you drool with that when you have it in your mouth for so long.
Makes sense,
But you
yeah.
could put a lot on one side and a little on the other side. So you could end up with lopsided colored teeth. Go to a dentist, do it professionally. It might cost a bit more, but ultimately they always do a cleaning before they do the whitening. And you do that treatment once, it will last for 6 months to a year, which just inspires you to look after your oral health care properly.
Ronald, thank you so much for this insightful conversation, and we hope to see you again next week.
Inshallah. Ameen.
Inshallah, Ameen. Because at home, that was Ronald Abvajee, who is our wellness expert, and we're just talking about National Oral Health Month and just overall, looking after your oral health as much as it contributes, to your overall health. And I hope you have learned a lot from this conversation, as I have learned. But on that note, we will head over to a quick break. We'll see you right after this.